Poverty and homelessness are two of the most pressing issues in the United States today. According to the U.S. Census Bureau, there were 46.7 million people living in poverty in 2014, and the Department of Housing and Urban Development's annual point-in-time count in 2015 reported that there are 564,708 homeless people on a given night in the United States. The National Coalition for the Homeless says that homelessness and poverty are inextricably linked, and that if you are poor, you are essentially an illness, an accident, or a paycheck away from living on the streets.
So I think that poverty exists because there are structures in our society that permit its existence.
There are all kinds of reasons, multiple reasons, sometimes mental health reasons, physical reasons, economic reasons, that people fall into poverty, and then the cycle begins. People struggle with addiction. What we often forget is addiction is a disease, not a moral failure.
I think that homelessness in particular is a problem in America. For several reasons. One is affordable housing. People can be working, 40 hours a week or 2 jobs and can barely pay rent.
The largest reason that people have trouble paying their mortgages is really a health-related emergency or a loss in job.
And quite frankly and candidly, it can happen to anyone. Working people can simply, for illness or a child's health care, fall behind in their rent and lose their housing.
It's pervasive. It's not something that's isolated to a particular type of segment of our population. It really is a national crisis.
However, there are a number of organizations, some government-funded and some not, that are trying to change conditions for those living in poverty or without a home.
Some's been serving the poor, the marginalized, and the homeless here in D.C. for 45 years. This is our 45th anniversary. We have moved from the dining room, which even to this very day as we sit here serves approximately 900 people a day, men, women, and children, breakfast and lunch, to now we have a whole continuum of services for people who come to the door here at SOM or in our programs, and those continuum of services include addiction recovery, mental and dental health, behavioral health treatment, and housing.
I made a bad choice, and it cost me my job. So when it cost me my job, I just couldn't believe it. Okay, I was 12 years clean when they told me I had to leave. I just knew I had to get a caseworker. Nope. She let me in, come and sit down. Told me all about the place, walked me around to what they do and how they do and what they do for you. I said, wow, this is nice. And when that happened to me, it made something happen inside of me. The depression wasn't that bad no more.
So my position at Miriam's Kitchen is I'm the director of housing, and so I manage our permanent supportive housing program of 95 formerly homeless adults. We help them look for apartments and move into apartments and stay stable in apartments so that they don't return to homelessness.
So NeighborWorks America is a national nonprofit, and we give money to other local nonprofits across the country to help them with their affordable housing goals.
Despite the enormous help provided by these organizations, there is still a lot of work to be done.
I think what we had this year was a good news, bad news story. We had a reduction in poverty from last year. We had a reduction in child poverty from 22% to 20%. So we roughly addressed the blip from the recession, got back close to 2007, but that's not an acceptable level. We still have 1 in 5 kids, 1 in 5 young adults, young people beginning their careers, ages 18 to 24. And because we know a lot about the lifelong consequences of poverty in those years, I think we have to take really seriously what we do next.
I think for things to change in terms of poverty, the government would have to realize, or would just need a better understanding of people.
That's where we need to start. not pointing fingers at people because they're poor or homeless or marginalized or struggling with addictions. And we're not there.
Have more programs for the people to go to and sit and learn how to take care of yourself.
What the government can do to address poverty is really look at the programs that it offers, particularly its housing programs, which I believe is really the base for a stable environment, and put more money into those programs.
Affordable housing is the only way people will come out of homelessness, and is the only way to prevent people from becoming homeless.
Raise the minimum wage, do more to provide people, or continue to provide people with health care, support Obamacare. The Affordable Care Act is really important so that people, if they do experience a health emergency, that they don't lose their home because of it.
We need the government to be more involved. We need more funding for private and religious sectors and nonprofit organizations. We also need more funding for affordable housing and affordable health care programs. But most of all, we need to start showing more compassion for those less fortunate than us.
I've heard many people who are homeless tell me that they feel invisible when they're homeless because people just avert their eyes. They walk around them physically.
I have found too often, that the poor and the marginalized are judged for being poor and marginalized without some real serious pullback and reflection on how did this happen, why did this happen, and can it happen to me?
I really believe that if we could get more people in this country to interact with people who are living in poverty and really understand their stories, where they come from, and realize, they're not that much different than we are, I think that would go a long way to building solidarity.